Hello everyone, I am Dr. Colonel Aditi Dusaj, Senior Consultant Ophthalmology at Sri Balaji Action Medical Institute. Today I shall be speaking on a very common condition, which is dry eye disease. Now dry eyes is a very underrated problem because almost everyone is suffering from dry eyes, whether it be children, it be women, especially in the post-menopausal age, or especially the age related or the senile conditions of the dry eye. Now dry eye can be because of two factors. Either there is a decreased production of the tears or there is an increased evaporation of the tears. Decreased production of the tears can be mainly because of aging. That is why people more than 50 or 60 years of age generally tend to have dry eyes. Other causes of decreased secretion can be diseases, systemic diseases of the body like Sjogren's syndrome or autoimmune diseases, rheumatoid arthritis. Other causes of decreased secretion of the tears can be allergic conditions, or patient is taking hormone replacement therapy, that can also cause dry eyes, and it can be postmenopausal women who suffer from dry eye disease. The second condition in which dry eyes occurs is increased evaporation. It can be because of people who are living in windy areas or where there is bright sunlight like Ladakh or high altitude areas, or increased evaporation because of meibomian gland disease, lid problems, MGD is a common condition, marginal diseases of the eyes, meibomian gland dysfunction can all predispose to dry eyes. Nowadays, especially in the COVID times, 2020, 21, 22, we have seen a lot of children suffering from dry eyes because of increased exposure to the screen. So what is more important is that children have to be told to follow the basic principles of blinking frequently while using the screen, rule of 20-20-20, meaning take a break after every 20 minutes for 20 seconds and look at something which is 20 feet away. Then children have to be told to drink lots of water, eat fresh fruits and vegetables. Vitamin A deficiency has been known to cause dry eye even in children. So substitution of vitamin A either through medicines or through good foods like carrots or green leafy vegetables, oranges, grapes, etc. can be good in children. People who have lot of computer work, especially young adults who are working on the computer in offices, can have dry eye diseases. They can be again told about frequent blinking, about restricting the use on the computer, about keeping the screen at least 16 to 20 inches away. The screen should be a little lower than your eye height, and you can decrease the illumination, increase the font size if required, not to work in bright light or in dark rooms. You can at least have a dimly lit environment that will help decrease dryness, decrease secretion, as well as increased evaporation. Now in conditions where the dry eye cannot be avoided and you do tend to have dry eyes, people tend to ignore the importance of frequent blinking and drinking plenty of fluids and water. What you have to do is you have to substitute the tear film. Tear film has three layers: outermost lipid, then aqueous, and innermost is the mucus layer. Now lipid layer deficiency is mainly because of the lid margin problems, and lid margin problems can be taken care of by using good quality wipes, taking care of the lid diseases, adequate replacement of the lipid layer of the tear film. Decreased tear film tear secretion, aqueous layer deficiency can be taken care of by lubricants, but patient has to be told that too much excessive use of lubricants can have preservatives in them, which can ironically increase your dry eye condition. So you have to be careful in using preservative free dry eyes tear film substitute. Then last but not the least is the mucus layer, which is the innermost layer of this. So you have to replace the mucus layer of the tear film, make sure that the lids are proper, patient is blinking properly, replacing the lipid layer, and taking care of all other necessary precautions. Thank you.